Every year, millions of people over 60 walk into their doctor's office with the same complaint. I'm exhausted all the time. No matter how much I sleep, I wake up tired. And every year, those same millions walk out with the same answer. Your B12 is a little low. Take a supplement. It's probably just your age. So they take the B12. They wait a few months, and the exhaustion is still there sitting behind their eyes every morning like a weight they cannot put down. Their family starts to notice. Their doctor schedules more tests. Everything comes back normal. You're fine for your age. But they are not fine. They feel it. They know it. Here is what nobody is telling those patients and what I am going to tell you today. In the majority of cases I have seen in 28 years of cardiology, the exhaustion is not about B12. It is about a mineral that lives in the shadow of every blood test you've ever had. A mineral so essential that your heart cannot beat properly. Without it, your muscles cannot recover without it, and your brain cannot shut down at night without it. A mineral that over 50% of adults over 60 are clinically deficient in right now, today, and that standard blood tests routinely miss, not because doctors are careless, but because the test most labs run only measures the wrong thing. That mineral is magnesium, and if you have been told your fatigue is just aging, I need you to stay with me for the next few minutes, because what I am about to show you may be the most important thing you have heard about your health in years. My name is Dr. Omosalua Adewale. I am a cardiologist. I have spent 28 years treating patients whose hearts were struggling in ways that looked, on paper, like routine aging but were anything but. Fatigue, palpitations, muscle weakness, blood pressure that refused to stabilize. And in case after case, once we looked deeper then. The standard panel, the same deficiency kept appearing. Tonight I want to talk about why that keeps happening and what you can do about it starting this week. Here is something you were almost certainly never told. Your body contains about 25 grams of magnesium. That sounds like a lot. But here is the critical problem. Less than 1% of it circulates in your blood. The rest lives inside your cells, your bones, your soft tissue. So when a standard blood test checks your serum magnesium level and comes back normal, it is looking at that 1%. It is completely blind to the other 99%. Think of it like checking the fuel level on a car by looking at the paint job. The outside looks fine, the tank is empty. After 60, your body's ability to absorb and retain magnesium drops significantly for 3 reasons that happen simultaneously and quietly. First, your gut absorbs less, gastric acid production decreases with age, and magnesium requires acid to be properly extracted from food. Second, your kidneys begin excreting more. The tubular reabsorption process becomes less efficient, so magnesium literally passes out in urine at a higher rate than it did at 43rd. And this is the one almost nobody mentions. If you take any medication for blood pressure, acid reflux, or diabetes, you are almost certainly accelerating magnesium loss further. Diuretics, proton pump inhibitors, and metformin are among the strongest known depleting agents for this mineral. Not as a rare side effect, routinely, predictably every single day. So what does magnesium actually do? The short answer is, almost everything. It participates in over 300 enzymatic reactions in your body. It is the cofactor your heart cells need to maintain a steady, rhythmic beat. It is the mineral your muscles require to release tension after contracting without enough of it. Muscles stay locked in a low-grade spasm. It is the gatekeeper that allows your brain to produce melatonin and GABA, the 2 compounds responsible for genuine deep sleep. And it is a key regulator of cortisol, your stress hormone. When magnesium is low, cortisol stays elevated. When cortisol is elevated at night, your brain cannot fully shut down. You fall asleep, but you do not recover. The result? You wake up tired every single morning, and your blood test says you are fine. I want to walk you through 5 specific signals that your body uses to tell you magnesium is critically low, not vague feelings. 5 specific, identifiable patterns that I have seen in hundreds of patients, patterns that cleared completely once the deficiency was properly addressed. Signal 1, fatigue that does not improve after sleep. This is the one that sends most people to their doctor in the first place. Not the tiredness you feel after a long day, the tiredness that greets you the moment you open your eyes, even after 8 hours in bed, the kind that makes getting up feel like climbing out of water. Here is what is actually happening. Magnesium is required to activate a molecule called ATP, adenosine triphosphate, the unit of energy your cells run on. Every cell in your body, but especially your heart cells and muscle cells, must convert stored energy into active ATP before it can be used. That conversion requires magnesium. Without enough of it, your cells are sitting on a fuel reserve they literally cannot access. You are not tired because you are old. You are tired because your cells are running on a fraction of the energy they should have. A 2012 study published in the Journal of Nutrition found that magnesium-deficient adults required significantly more oxygen and energy to complete the same physical tasks as magnesium-sufficient adults, meaning their bodies were working harder to do less. If your exhaustion is not explained by thyroid levels, iron, or B12, the next thing your doctor should check using an RBC magnesium test, not a serum test, is magnesium status. Ask for it by name. Write that down. Signal 2, muscle cramps that wake you at 3 in the morning. If you have ever been jolted out of sleep by a calf cramp so intense it took minutes to walk off, that is your body sending a signal. Magnesium's job in a muscle is to compete with calcium. Calcium triggers a muscle to contract, magnesium triggers it to release. When magnesium is low, calcium dominates, muscles contract more readily. Stay contracted longer and fire inappropriately during rest, especially at night, when the body is still and circulation slows. These cramps are not just painful. They are a cardiac warning in disguise. The same mechanism that causes your calf to cramp at night operates in the smooth muscle surrounding your blood vessels and in the cardiac muscle of your heart wall. A study published in the American Journal of Clinical Nutrition in 2018 found that adults over 65 in the lowest quartile of magnesium intake had a 58% higher rate of reported nocturnal cramps and measurably higher resting arterial tension compared to those with adequate intake. When your calf cramps, your coronary arteries are under the same low-grade stress. The fix is not complicated. 400 milligrams of chelated magnesium daily glycinate or malate form has consistently outperformed magnesium oxide in absorption studies. Most cheap drugstore magnesium is oxide. Read the label. The form matters as much as the dose. Signal 3, heart palpitations or a fluttering sensation in the chest. This one I take seriously every time a patient describes it. Not because every palpitation is dangerous, most are not, but because in a magnesium-deficient patient over 60, they are a warning the electrical system of the heart is operating without adequate support. Magnesium regulates the sodium-potassium pump in cardiac cells, the mechanism responsible for maintaining the precise electrical balance across the cell membrane that produces a steady heartbeat. When magnesium is depleted, that pump loses stability. The heart's electrical signals become erratic. You feel it as a flutter, a skipped beat, a racing sensation that comes out of nowhere. The connection to atrial fibrillation, the most common heart rhythm disorder in adults over 60, is particularly well established. Multiple studies, including a 2017 analysis in the journal Nutrients, found that hypomagnesemia is significantly associated with both the onset and recurrence of a fib. Cardiologists sometimes see patients spend years on rhythm control medications while their underlying magnesium deficiency goes completely unaddressed. If you have been diagnosed with palpitations or a fib and nobody has checked your RBC magnesium, ask your doctor directly. Has magnesium depletion been considered as a contributing factor? Signal 4. You cannot fall asleep, or you wake at 2 a.m. and cannot go back. Magnesium is the single most important mineral for sleep in adults over 60, and it is almost never discussed in the context of sleep problems. Here is why. Your brain requires magnesium to produce melatonin, the hormone that signals the body to initiate sleep. It also requires magnesium to activate GABA receptors. GABA is the primary inhibitory neurotransmitter, essentially the brain's off switch. Without adequate magnesium, your brain cannot fully activate GABA signaling, which means it cannot quiet itself. Your thoughts keep cycling, your body feels tired, but your mind will not stop. Simultaneously, a magnesium-deficient body tends to have elevated cortisol, the stress hormone, well into the evening, when it should be declining. Cortisol at midnight is physiologically incompatible with deep restorative sleep. You may fall asleep from exhaustion, but you cycle through lighter sleep stages and wake in the early hours. A 2012 randomized controlled trial published in the Journal of Research in Medical Sciences found that elderly adults who took 500 milligrams of magnesium daily for 8 weeks showed significant improvements in sleep onset, sleep duration, and morning cortisol levels compared to placebo, not a supplement brand's marketing. Document a peer-reviewed randomized trial. If you have been offered a sleeping pill before anyone checked your magnesium, that is a conversation worth revisiting with your doctor. Signal 5, blood pressure that will not stabilize despite medication. This is the one that changes how I practice cardiology. I have sat across from patients on 2, 3, even 4 blood pressure medications whose numbers still swung unpredictably higher in the mornings, inconsistent throughout the week, resistant to every adjustment we tried, and in a significant proportion of those patients, the missing piece was magnesium. Here is the mechanism. Magnesium is a natural calcium channel blocker. It competes with calcium at the receptor sites on vascular smooth muscle cells, the cells that line your blood vessel walls and control how tightly they contract. Adequate magnesium keeps those cells relaxed. Deficient magnesium allows calcium to dominate. The vessel walls stay in a state of chronic tension, and blood pressure remains elevated despite medication. A 2016 meta-analysis published in the American Journal of Clinical Nutrition covering 34 clinical trials and over 2,000 participants found that magnesium supplementation reduced systolic blood pressure by an average of 2 to 5 millimeters of mercury. In isolation, that sounds modest, but combined with dietary changes and properly timed medications, it represents a meaningful additive effect with no additional pharmaceutical burden. If your blood pressure has been described as resistant hypertension, ask your doctor whether hypomagnesemia has been formally ruled out, not with serum magnesium with an RBC magnesium test. I want to tell you about Dorothy, 72 years old, retired ICU nurse from Charlotte, North Carolina. For decades of taking care of other people's most critical moments, knowing every drug interaction, every lab value, every alarm that mattered. She is precisely the kind of patient who does not miss things, which is why what happened to her for 3 years is something I think about often. Dorothy started waking up exhausted in her late 60s. Not the tired after a busy day exhausted, the waking up already depleted kind. She noticed calf cramps at night, a fluttering sensation in her chest 2 or 3 times a week, and a mind that raced from AM until AM regardless of what she did before bed. She saw her internist, her cardiologist, her neurologist. B12 was slightly low, so she supplemented. A mild sleep aid was prescribed. Her blood pressure, already managed with 2 medications, became harder to control. Her morning readings were 15 to 20 points higher than her afternoon ones. 3 doctors, 3 years. The word magnesium was never mentioned once. She came to my clinic after a former colleague suggested she ask about it specifically. When we ran an RBC magnesium panel, not serum, RBC, her level was in the lowest 10th percentile for her age group, severely depleted. She had been on a PPI for acid reflux for 6 years and a thiazide diuretic for blood pressure for 8. Both are among the most potent magnesium-depleting medications in regular clinical use. Nobody had ever reviewed what they were removing. Dorothy, being a nurse, made one thing harder, not easier. She told me, I knew what to look for in every other patient. It never occurred to me it could be this simple for me. That sentence is the thing I carry from her case. Within 6 weeks of starting chelated magnesium glycinate 400 milligrams in the evening, the AM waking stopped. The calf cramps resolved within the first month. The palpitations became rare, then almost absent. Her morning blood pressure readings dropped enough that her cardiologist was able to reduce one of her medications. At 4 months, she described her energy as, and this is her exact word, returned. Not improved, returned, like something she recognized. She called me 3 months after that. She had started a small group at her former hospital, meeting with nurses nearing retirement to talk about the things nobody tells you about your own health when you spend a career caring for others. Dr. Harmon, she said, why didn't anyone tell me this sooner? I did not have a satisfying answer then. I am trying to give one now. Here is what I need you to understand. Your doctor did not fail you by missing this. The system did. Standard blood panels do not include RBC magnesium because it costs slightly more and is not on the default order set. Serum magnesium is ordered instead, which misses the majority of deficiencies. Nobody is being careless. The tool being used is simply the wrong tool for the job, and most patients never know to ask for a different one. Your doctor did not lie to you. They gave you an incomplete answer. There is a difference, and now you have the rest of it. A diagnosis of fatigue as aging is not a verdict. It is a placeholder. You have the right to push past it, not with confrontation, but with specific, informed questions that redirect the conversation toward what has not yet been checked. You are not a passive recipient of a workup that stops when the standard tests come back normal. You are an active participant who can walk in with a list and walk out with an order for a better test that is not difficult. And after everything you just heard, it is not optional. The Magnesium Morning Protocol, your 5-step plan. Before I close, let me give you something concrete. Not a list of supplements to buy blindly, a protocol. 5 steps in order, starting tonight. Step 1. Request the right test. At your next appointment, ask specifically for an RBC magnesium test, red blood cell magnesium, not serum. Write those 3 words on a piece of paper and hand it to your doctor. It costs between $30 and $60 out of pocket if your insurer does not cover it. That is a worthwhile investment for the information it provides. Step 2. Audit your medications. If you take any of the following, you are likely losing magnesium faster than you can replace it through food. Any diuretic, any proton pump inhibitor, omeprazole, pantoprazole, lansoprazole, metformin for diabetes, or any corticosteroid. This does not mean stopping those medications, it means having a direct conversation about what should be supplemented alongside them. Step 3. Upgrade your magnesium form. If you are already taking magnesium and still feel the signals I described, check your label. Magnesium oxide is poorly absorbed. The research consistently supports chelated forms. Magnesium glycinate for sleep and anxiety, magnesium malate for energy and muscle cramps, 300 to 400 milligrams in the evening. Give it 6 to 8 weeks. The changes are not dramatic overnight, they build slowly, and then one morning you realize the weight behind your eyes is lighter. Step 4. Eat 4 magnesium daily. Pumpkin seeds, 2 tablespoons, are one of the most concentrated dietary sources available. Dark leafy greens cooked in a little olive oil. Dark chocolate, 70% or higher, 1 or 2 squares. Almonds, avocado, black beans. These are not exotic. They are foods you likely already enjoy. Make one of them a daily habit. Step 5. Track one signal for 2 weeks. Do not try to measure everything. Pick one: sleep quality, morning energy, blood pressure consistency, or frequency of cramps. Track it as a simple 1 to 5 daily score. At the end of 2 weeks, you will have objective data to bring to your doctor, not just a feeling. Doctors respond to data. Give them data. Before I sign off, I want to ask you something directly. Type in the comments right now. How many of these 5 signals do you recognize in yourself? 1 through 5, just a number. You will be surprised how many people watching this right now share what you are feeling and have been told the same thing. It's just your age. It does not have to stay that way. If this video gave you something useful, share it with one person in your life: a spouse, a sibling, a friend over 60 who has been brushing off their fatigue for years, who has accepted tiredness as a permanent feature of who they are now. You may be handing them back something they thought was simply gone. If you have not subscribed yet, please do. Every week I bring you honest, evidence-based information I wish every patient had access to long before they ended up needing something more serious. And if this was helpful, hit the like button. It helps people who need this reach it. Take care of your heart. It has been beating for you every second of your life without ever asking for a break. The least we can do is pay attention. Everything I have shared today is general medical information based on published research and my clinical experience as a cardiologist. It is not a substitute for your personal medical care. Every person's situation is unique. Please do not stop or adjust any medication without speaking to your own doctor first. Bring this information to your next appointment not as a challenge, but as the beginning of a better conversation. Your doctor is your partner in this. That partnership works best when you are informed.